Today we have got another topic of medical education series, and here we will share the differences between disciplines based, organ based, problem or case based, and clinical presentation based teaching systems. We will discuss different points like teaching method, which teaching method is used primarily in discipline based, which one is in the problem based, in clinical presentation based, and these are going from traditional towards the more modern one. Like discipline based is the one of the oldest teaching methods, followed by organ based, followed by problem based, and the latest one is clinical presentation based. So content controller, organization of the content, clinical and basic relation, organization of course, cognitive skills emphasized, and learning guides, exposure to patients. So all these are the variables that will be checked. Like teaching method in discipline based is purely lectures, whereas in an organ based it is again mainly lectures, but with some small group methods are also utilized. In problem based, emphasis is more on the small group teaching methods, whereas in clinical presentation based there is a 50-50 proportion of small groups and lectures. So that was the teaching method of different. Now the organization of content is around discipline. In discipline based, around organs. In organ based, around clinical cases, and around 120 clinical presentations. So clinical presentation based system is the most specific one. Then content is controlled by departments in discipline based, topic committee in organ based, and curriculum committee in case based or clinical presentation based. So then comes the relation between discipline based and clinical. It is separated in the discipline based 50-50 interdigitation within context of organs. In the organ based, in case based, integrated within the context of clinical cases, and in a clinical presentation based, integrated 50-50 within the context of problem specific schemes. So again that is more discrete. Then organization of concept, it is around individual disciplines. In discipline based, it is around organ systems, abnormal versus normal, and clinical features, signs, symptoms. In the problem based, it is around clinical problems. So it is around clinical problems defined by learner, tutor and small group interaction, whereas in clinical presentation scheme it is around presentation specific expert derived schemata. So cognitive skills emphasized in discipline based critical thinking, and in all other three problem solving in organ based, case based as well as clinical presentation based problem solving. Learning guides in discipline based, lecture notes and textbooks. In organ based, learning objectives and textbooks. In case based, learning objectives and clinical presentations problems. And in clinical presentation based, teaching, learning objectives and expert schemes. Exposure to patients is delayed in discipline based, early but limited in organ based, early single exemplary cases in problem based, and early multiple exemplary cases in clinical presentation based. So that was the differences between different curricular teaching methods: discipline based, organ based, problem based and clinical presentation based. Thank you.